Mike Mbizo. I'm Director for Reproductive Health and Research in WHO. Very pleased to have been part of this initiative, which has culminated in the World Report. The issue of maternal mortality is very dear, very close. Certainly it is an MDG where progress has been uneven and slow. We have looked at the causes, the immediate causes, and we know many of the immediate causes, often which are preventable. But we decided for the purpose of this article to go beyond those immediate causes, which include, the immediate causes include excessive bleeding, for instance, in women during pregnancy or childbirth, complications of high blood pressure during pregnancy, infections, and others. But apart from those immediate causes, we felt that it's also very good to look at the policy environment. Do we have a policy environment which is conducive to saving lives? And if so, what are those policies? And the way we did this is to look at the countries where marked reduction has been observed with the view to drawing lessons. Looking at number of sources of data, published literature during the period when we see reductions, doing a survey to also see what the countries report themselves during that time. And the issues we saw in terms of policy related to, for instance, proactive actions and policies being taken to ensure there is skilled attendance during pregnancy and delivery. We've also seen policies that relate to wider availability of family planning. We've also seen the impact of the education of the female, the girl child. Very important. In fact, I would like to underscore this in that even when we controlled for some of the immediate causes, the issue of the level of education of the girl, of the woman, tended to be dominating. The question of parity, when you adjusted also for other immediate variables, you tended to see that the women who had higher parity who had more children. So again, a reflection of family planning. The aspect of financing, the demand side is very important. How are health services financed to ensure there is access to care? Where there were introductions of insurance schemes or of free maternity care, we certainly saw that in those countries the clients were palpable. So what I would like to underscore and what we are discussing in this article, where we took case studies in selected countries, really the upstream issues which contribute to positive benefits downstream. Even if we would like, we would not dismiss the need for ensuring that when those complications arise, there is need for immediate action. I'll stop here for now. Thank you.
Well, to follow up, if you look at this world report that only comes out every 3 years with the Congress, I think it's an extremely important source of information, and I would like to compliment Sir Kumaran for putting in also examples of special countries, because maybe by analyzing success examples we can deduct those criteria that determined success. I mean, yesterday we heard that overall maternal mortality has gone down, but I think we noticed quite a discrepancy between countries. And these positive examples, if you read the articles, they are in all the continents. There's Sri Lanka, that Sorul Kumaran was involved with, but there's Costa Rica, and there are all kinds of positive examples. And in Africa, we put in the example of Eritrea, because that is a special situation, very small country, only 5 million inhabitants, and one of the probably most troubled countries, because they had, as you know, 30 years of war, of separation from Ethiopia. And out of that, they also even had some problems with international organizations. They thought they're not protecting the borders enough, and this then led to an importance, especially of NGOs who were accepted as partners, and I was involved with one of them from Germany. But it's quite amazing to see what this concept then of self-reliance on the one hand, and then working together with trusted partners could achieve. And just to summarize key achievements that are listed in detail in the article, for example, to have at least one prenatal visit in 1995 was only 19%, and that it has increased to 2000 to 69%. Or vaccination, for example, measles, DPT, from 40% to 95%. So this shows that it's never a single factor that determines success, but a whole variety of elements that have to come together. Genital cutting, which was almost universal in Eritrea, 98+%. Currently, the estimate is that it's only around 40%, and this was, for example, an effort directed also towards men going to teachers, having teachers tell they don't do it in their own family and so on. So it was a whole combined activity, but one aspect that we think now in analyzing the success that probably was the main determinator of success was that they were quite successful in centralizing obstetric service. So if only 40% of the women had access to emergency obstetric care, that has increased to 84%. And for example, in Asmara, the capital, the number of deliveries in the central hospital that has the facilities, they have the commodities, they have blood products, they have the ability to do surgeries in case of postpartum hemorrhage. The number of deliveries there has increased from 5,000 to 9,000. And this was because the hospital was able to present itself over time in a different way. I think originally the image often was it's a place where you have a high risk of dying, where the family cannot attend, and that was changed. And so the plan is now to have a similar facility in the second biggest city, Karen, which and probably will have more than 2,000 deliveries also. Overall, all these activities combined, and I can only summarize them here, led to a reduction of the maternal mortality ratio, which is of course a very important factor to measure that, from 998 to 486 per 100,000. So this is a reduction by half, very significant in comparison. Under 5 mortality from 150 to 58 per 100. And so I think there are lessons to be learned from there, that the commitment of the government that was mentioned by Mr. Kumaran was there and was kept up throughout the process. The local needs were accepted, and ultimately, even though I mentioned there was this reservation for international organizations like UN, and so on, now this country is a candidate also for the global initiative. They also rely on positive examples and projects that contain lessons, and so it just shows that this type of cooperation can have lasting results. And it's just a small example, not so positive.